Now that the country appears to be on a spending spree and wages are rising, the stock market's up, more and more of your patients are going to be looking for those elective procedures. Things like teeth whitening, veneers, implants, and restorative work are on the table. Now, there's considerably more money to be made in these non-insurance, high-margin, fee-for-service type cases. Savvy dentists will take steps to position themselves as the dentist of choice in their markets. After the break, I want to tell you the proven strategy to making sure these better prospects elect you as their dentist. Stay tuned. I'm Colin Receiver. Thanks for watching the Patient Attraction Podcast. Now, last year, dental industry pundits identified growth in elective procedures as one of 2018's big opportunities. Since the federal government has passed tax reform, higher income prospects will have even more money to pay for elective dental procedures. A significant number of teeth whitening treatments, veneers, implants, full mouth reconstructions can do wonders for your practice's bottom line. But first, you've got to get those cases. However, the other practices in your market are probably going to also be trying to attract those prospects. What will you do differently in your marketing approach? For most dentists, the first thought is to offer a lower price. Of course, it's almost certain that one of these practices will undercut your price, which puts you and them into a price war. Now, you can bleed away a lot of profit by trying to be the discount dentist, but that's not the only problem with that strategy. As a dentist, you likely have a lot more discretionary income than your average person or average patient. When you go on a vacation, are you looking for discount hotels? My guess is not, because you're more focused on the value and comfort and amenities. You're interested in having a great experience while you're on vacation. Now, all things being equal, if two hotels in the same area offer comparable amenities, you might go with the cheaper one. But that's a secondary consideration. Your better prospects with discretionary income aren't clipping coupons and Valpaks and Groupons. They are looking for a superior patient experience. A superior outcome is expected regardless of which dentist they choose. So forget price as the primary motivator. All you're doing is shooting yourself in the foot. Your marketing has to take a broader approach that makes you the only logical choice for prospects with money to spend. To accomplish that, you're going to have to invest. You're going to have to rework your marketing and online presence. Too many dentists talk about themselves, their training, what I call the me problem in their publications. Me this and me that. Few prospects understand the difference among postdoctoral training programs, and practically none of them are going to read your papers. They don't care about you. They care about what you can do for them and how you'll treat them during their experience in your practice. You'll probably have to rework your website copy and your social media to emphasize the benefits of choosing you and your staff. The same goes for any email marketing or newsletters you might be doing, or even postcard campaigns. It's a one-time intensive project, and it requires a different mindset to write all the copy to put the patient first. Not all dental practices have the bandwidth to handle that huge amount of retailering. Not all practices have the strategy to implement something like that. So this is something you might want to consider hiring a professional to handle for you. Just make sure you choose a provider with a proven track record for attracting the better kinds of patients. That way, you can reposition your marketing to attract prospects with the ability and the willingness to pay more for the right dentist while you continue to focus on doing the dentistry. Now, my company works with 550 dentists around the world. We help them to put butts in their chairs with a steady stream of new patients, so that our doctors can stay focused on doing the dentistry. If that sounds appealing to you and you want to see what a patient attraction system can do for your practice, click the Get Started button on our website. Set up a call with us. It's a 15-minute introductory call to learn about your practice and goals, and let us develop a plan, complimentary, to show you how we can take you there. There's money to be made on elective cases, and if you're not properly positioned, somebody else is making it. Join me for our next podcast. Until then, keep moving forward.